Colleagues, we're in the final stretch, and congratulations to all of you who have made it this far. We're saving the best for last. So we got gender and humanitarian as our last two segments. And without further ado, let me ask Lauren Rumble, the head of the gender team, to come up and do the presentation. Lauren, over to you.
Okay, everybody can hear me. The sound's been a little bit on and off throughout the day. First, let me just extend my thanks to the excellent gender team. Colleagues, if you can wave to everybody that has helped to create this presentation. And we're a small but powerful team helping to integrate the work of gender equality across all the work that we do. Let me pause for a second and just dwell on what it's like to have your future defined by your gender, which is still a reality for many girls and women across the world. We know that they are disproportionately affected by conflict and violence, by emergencies, by disasters of all different kinds. They're shouldering, as we talked about in the previous panel, an uneven distribution of unpaid care work. They're also largely the volunteer, unpaid workforce at the front lines, whether social welfare, as Cornelius spoke about earlier, or in health in the public health system, as Health talked about, unpaid, unrecognized, unrewarded, and still shouldering care work when they return home after a long day's work. So with these realities, when we know that it is so difficult to live a life of fear, shame, and stigma simply because of our gender, this means UNICEF really had to ensure that we have a deliberate and targeted strategy to address gender. And that's what we call the Gender Action Plan 2018-2021, or GAP for short. It's worth dwelling on this for a moment because we're quite proud of it. It's a really solid architecture across all the work that we do, across all those publications on the table that I'm so happy you're taking home with you. And it works at 3 levels. In turquoise, we have the integrated, or what some organizations call mainstream priorities. How are we making our large programs in health, child protection, and education more powerful with a gender equity perspective? And then in the darker blue, the second bar, are targeted priorities. This is when, based on evidence, compelling data, we were able to say that there are some specific targeted actions and outcomes that we as an organization need to focus on for adolescent girls because of the disproportionate violence and lack of access to services that they face across all contexts. And then on the right, it's what we're doing as an organization to be more gender responsive. So we've mentioned a little bit today about family-friendly policies. If we're going to advocate that with governments and the private sector, here at UNICEF, we need to be strong and make sure that the workforce is more inclusive and gender equitable. We also need to increase the gender capacity, making more freely accessible gender expertise to all the programs who need it. Those are just a few of the examples. So holding ourselves accountable as well as promoting work on gender equality through all the work that we do. So I won't talk for long. If I could just have a show of hands, how many of you will be in the executive board tomorrow? Okay, just maybe a quarter. So I then will take a second to just dwell on some of the results, and we have seen them in the broader sectoral presentations. We've seen more and more national plans integrating maternal and newborn health care. That means more legislative and policy reform dedicated to safe births for mothers and babies. We started off a baseline of 3. We had a target of 9 in 2018. And what did we achieve? 23, more than double. Another area where we've exceeded our baselines and targets for 2018 is in nutrition counseling, making sure those same mothers who are delivering safer births with more skilled birth attendants have access to nutrition counseling and care because of the importance of breastfeeding for longer-term nutrition outcomes for children and ultimately women. We hoped to achieve 50, and we ended up with 55. So in at least 3 areas in health and nutrition, we have exceeded the targets that we set for ourselves. Just a concrete example, and following on this panel that Alex led so beautifully on social protection and inclusion. Here's a really lovely example of when a deliberate gender design in cash transfer programming yields positive multiplier benefits for both children and women within a household. This family was a recipient of a cash grant in Ghana, specifically targeting pregnant women and new mothers. And along with the cash grant came caregiving and parenting programs, as well as peer support and financial literacy program training. And what was the outcome? Through a randomized control trial, one of the best sources of evidence, the gold standard, we find that not only are children doing better in those households with more diverse diets, more exclusive breastfeeding rates, but also women are feeling more confident, more empowered, able to make decisions, and actually reporting higher levels of happiness and confidence. And then, most powerfully maybe, is reduced levels of intimate partner violence, busting the myth that increased economic empowerment for women increases their risk of violence, and also showing that more investments in both economic and social capital does improve the overall economic status of a household, which of course has accelerated effects for the household, the community, and the country as a whole. We want to see more of these kinds of programs, which tend to be underfunded worldwide. In the education sector, how have we integrated gender into the thinking and into the reporting? One huge gain in this sector, as we mentioned this morning, is more disaggregated data, so we can know what's happening, as well as more gender-sensitive programs. 38 countries have established gender-responsive education systems. That's quite powerful. Of course, 38 is not yet enough, but the fact that we're doing this so deliberately and measuring our results is a win. Now I'm just going to show you some disaggregated data that still reveals gaps and the power and importance of data that remains with us. We see here that yes, we are able to provide data on more girls and boys receiving education access in some of the most difficult conflicts and crises. But at the same time, we see a perpetuated lack of access for girls, calling on the need for more concerted efforts in this area. And in child marriage, and we're going to talk about this a little on the panel with my colleague Cornelius from Child Protection, one of our joint programs, our joint partnerships with UN Women and UNFPA, tackles ending child marriage. We're seeing an overall decline in child marriage rates, one of the first SDG indicators to move positively in the right direction. And this partnership is helping to shift national frameworks. We have more national action and strategies to prevent child marriage and respond to the services that girls need, 15 in fact. And we're also being able to provide direct services to adolescent girls when and where they need it in the countries where the program is active. Nearly 5 million, which is really rather an extraordinary number. On the other hand, on the right-hand side, this data looking at child marriage prevalence tells a rather sorry story in some regions of the world. West Africa, Southern Africa, all rates above 25%, and even Latin America most recently with its recently published report. What do we need to do? We need to work in a very targeted fashion, not only where the joint program is operating, but learning the lessons of what works and expanding those models of good practice across civil society with the public sector, and of course with the private sector as a champion, particularly on social norms change. As Kelly mentioned, menstrual hygiene and health is an area of phenomenal growth. What started off as really small seed and catalytic funding from the government of Canada has now blossomed into active programs in more than 69 countries. And this says two things. One, it's a cost-effective program that's able to reach millions of girls at scale. And secondly, it's an area where many sectors can work together. Innovations, for example. Let me just give you an image here. This is from the last country where I worked in Indonesia, where we're working with mobile companies, young people themselves, to design apps on mobile phones to provide access to health information. This in particular is a period tracker app, also being piloted in countries like Brazil and Kosovo. We're also seeing that we're able to work with supply chains, helping to provide menstrual hygiene kits during emergencies, and also influencing curricula and government supply chains so that all schools have better access to affordable sanitation, water, and menstrual hygiene services for girls, which we know that menstrual hygiene taboos are really one of the factors why girls may drop out or not attend school, therefore unable to complete their education and go on to become productive citizens. Good, I have a question just popped up on my screen. Isn't that nice? It means that somebody's listening. Areas for accelerated action. Where have we not done so well? Well, we've covered several grounds this morning. One is in disaggregated data. I'm unable to provide that powerful data that I showed you in education for all our sectors. And this is a combination of problems. Sometimes the data doesn't exist. Sometimes we don't have the capacity within our partnerships or ourselves to actually collect that data and track it over time, as well as analyze it. And other times, we simply haven't built in the systems for recording disaggregated data. We know too that in the HIV burden, that there's an unequal access to testing, counseling, and treatment amongst girls and boys in particular regions of the world, including where I come from in sub-Saharan Africa. And we need to do more to make these services accessible to all children and pregnant mothers of all ages. And finally, documentation and learning. Whilst we have a proliferation of programs on the ground that are working to shift gender norms, for example, we don't yet accompany those programs with rigorous evaluations, sometimes because of budget reasons, sometimes because we're just working so fast to capture the lessons learned and really deepen our knowledge of what works and what doesn't work so that we can leverage greater public investment in these solutions. Thematic funds, however, have such a powerful role in catalyzing change on difficult issues that governments don't want to work on, or where we really think that there's potential, but we don't have proof yet that it can work. And two examples of such catalytic funding and the use of thematic funding here is on the left in Nicaragua, where we were able to conduct, together with our child protection teams and the office as a whole, a first ever survey on violence against women and girls, which then prompted a national outcry and demand for better services. And now the country really has in place increased resources for survivors, both children and women. And on the right-hand side is yet another example of the power of social norm change at community level. This is working with communities in Niger, where they're discussing the harms of child marriage on girls and on communities at large. And as a result of that intervention, slow, steady, and hand in hand with the community, we saw over 100 child marriages prohibited by village chiefs and traditional leaders within the year of 2018. Small scale, but results that last. So where do we go from here? A couple of exciting areas that have already come into the discussions today. We want to work more on this difficult gender social norms area, or positive gender socialization, really getting right to the heart of why people believe the things they do, and trying to shift those to more positive beliefs that benefit women and girls. We want to understand how we can support frontline care workers, the women that care for other women, the social workers, the health volunteers, the child care workers working in ECD centers, largely women, largely unpaid. How can we ensure that they have consistent mentoring, training, support, and are formally recognized? For example, like the government of Ethiopia has formally included volunteer health workers into their payroll so that they become a sustainable part of the primary healthcare system. Family-friendly policies, we've talked a lot about that today, and thank you so much for the excitement in the room around that. Prevention of gender-based violence. We know that we were able to provide support and care to around 1 million girls and boys during crises with gender-based violence response services. But how can we go beyond response? How can we learn the lessons from this and create an overarching framework that works for girls and boys across all settings, hand in hand with UNFPA, UN Women, and our civil society partners? And finally, gaining ground in social protection, being really deliberate around gender equitable outcomes. We want to see more Ghanas. Already there is a universal grant for girls in India benefiting around 16 million young women, which is helping them address financial barriers and access to school. How can we learn from that? How can we do more of that so that every girl everywhere faces less and less barriers to their education and ultimately freedoms? Spending. Let's look at the money. Well, of course, we start with the good news. We in UNICEF, like many of you in your organizations or partnerships, are getting better at tagging, tracking, and monitoring gender expenditure. So we know that we have a dedicated 14.1% in 2018 for gender transformative work. Not just a little bit for gender equitable work, but gender transformative work. This is pretty close to the UN-wide target of 15%, and I think we might be one of the leading agencies in this regard. Of course, we still have to move that needle a little bit larger, but this is a good start. Thematic funding contribution, less than 1% of overall thematic funds goes towards our gender equitable work. As I said, that little bit is so powerful when used as a catalytic source for data collection, improving data strengthening system, for social norms work, for deliberate gender perspective in larger programming models. We'd always welcome more, but we're learning, and with increased documentation and partnerships with all of you, we will continue to do our best for women and girls everywhere. Thank you so much.
Thank you very much, Lauren. As Lauren has said, and we've also described a couple of times, this final part of the day focuses on gender and humanitarian action, which, if you will, are the two beams that cut across the whole of our strategic plan. Because our work on gender and the work that we do in humanitarian settings, on humanitarian action, really underpin everything else that we do. And for that purpose, we have a panel that actually brings together colleagues from different parts of the House. And if I can ask Lauren and the colleagues to come up, so Brooke and Chemba and Cornelius, please join Lauren. I understand that Chemba has got a plane to catch. She's on her way to Jordan to work on issues related to parenting. So what I might suggest, Chemba, given that we don't want you to miss your plane, is perhaps if you could say something up front, even before the questions come through, about the kind of intersect between ECD and gender, and specifically how you all work together. It'd be useful to hear from you, and then we'll let you go to Jordan. I'm sure your colleagues in the audience can answer any questions that come up.
Thank you so much, Ted. Thank you, Lauren, for the opportunity. I'm delighted to be here also because I was a gender focal point until recently, so it informs a lot of our work already. From ECD, it's very important that we bring a gender lens to the early years. As Lauren has indicated, it's very important in their first priority area of changing gender norms and gender socialization. So that's definitely on the cards, that we're already working towards providing tools and resources and guiding documents to countries on how we can ensure that a strong gender perspective is brought to bear on programs in parenting, in caring for caregivers, as well as care for child development. So we're bringing the gender lens. So that's one definite concrete area. A second area has to do with your second priority, which is the unpaid care, etc. The notion of childcare is central to both the gender work as well as the early childhood development work. So this is not an area we can work in silos on. So we have to come together as an organization to work on childcare, particularly unpaid childcare, and the unrecognized volunteers that are engaging in the business of caregiving for young children. A third, and I'm very glad to hear about the excitement in the room on family-friendly policies. It's our newest agenda. It's really important for us to shift the needle on 4 transformative sort of areas. So we are looking to shift the needle from maternity to parental leave. We are looking to shift the needle from individual to co-responsibility in childcare. We are looking to move the needle from infrastructure to people, not just building rooms for breastfeeding, but also tackle the discrimination and retaliation that sometimes women, particularly in the informal sector, face. And 4, moving the needle from just reducing parental stress to actually a more positive view of enhancing parental well-being. So these are 4 shifts, and in response to those 4 shifts, we have 4 asks. Paid parental leave, remunerated breastfeeding breaks, quality, affordable, accessible childcare, and child benefits in the form of child grants and transfers. So that's another area that we'll be working in. 3 areas to begin with. I think the plate is quite full, and we look forward to working together.
Thank you, Chemba. That's very helpful. have a good trip to Jordan, and maybe Nada can come up and sit on the panel in case there's any other questions.
Thank you very much.
Colleagues, we've had a good presentation by Lauren and good additional inputs from Chemba. Any questions, comments, contributions that you'd like to make? The floor is open. Absolutely, go ahead.
So thank you very much for the excellent presentation, and I know my colleagues will be speaking more at the meeting tomorrow, providing specific comments. So we found the report really well written, of course, and it's great to see that UNICEF's approach towards gender equality is really focusing on integrating gender results and targeted priorities. I work with follow the WASH program. So in relation to, we want to commend you, of course, on the increased focus on providing access to dignified menstrual health and hygiene, and for bringing those activities to the attention. My question is with regards to working with other areas in education, for example, and finding how aspects of menstrual health, for example, and hygiene are keeping girls in school. How are you following those aspects? And also with regards to one of the aspects that you brought up in the presentation is, we take note on the slow gender integration for improving HIV prevention among girls. We heard a presentation earlier this morning, and this is something that we would like to hear more about, so maybe you can comment a little bit on that.
Thank you for those questions. Anybody else? Nope. Can I then throw one into the mix then? The whole issue that's come up a couple of times today, I think, on the work on gender-based violence. We put, I think, also a lot of efforts around prevention of sexual exploitation and abuse, and I think there's been a certain recognition that stopping the harm that as a community we might do, or elements of our community might do, is primordial. But I think there's also been a sense that we don't have sufficient resources for looking at gender-based violence more broadly. So it'd be good to hear perhaps from both Cornelius and Lauren where we are with this area of work. And with that, perhaps back to the panel.
Great. Thank you, Anna, for your question on safe and dignified menstrual health and hygiene. I'll respond just quickly on measuring keeping girls in school, which, as you know, has been a big challenge in the field. So there are two things that I wanted to highlight that we're doing. First is the new program guidelines that we have just released on Menstrual Hygiene Day, which we're very excited about, are aimed at strengthening our theory of change across integrated adolescent programming for girls and boys. So this is something that we hope will improve the quality of our programs, their completeness, and therefore our ability to monitor them against objective indicators. Now, to develop that monitoring piece, we're working with a collection of partners and academic institutes. Some have been long-term partners like Columbia University and Emory University that you know, along with new partners that are engaging in a lot of research in this space like Johns Hopkins, to look at how we can monitor changes that have to do with girls' self-efficacy and self-confidence, as well as with their school attendance, which is, again, kind of been tricky just in terms of being able to collect reliable attendance data. But we know that there are other pathways through which girls' their school performance can improve when they have access to safe and dignified menstrual health and hygiene.
Yeah. Oh, well, I thought maybe you'd had enough of hearing from me, and I was excited to hear from Corin. You know, in a way, here in the gender team, for us, success is when more and more colleagues within UNICEF are able to speak so compellingly, as Brooke just did, on the issues we have in our strategic plan. So that's really nice to see, and thank you to all the panelists for joining us. On gender-based violence, let me start there and then hand back to Corin, and we'll come back to HIV. Thank you for the great and very generous comments. We've really enjoyed working with you. On gender-based violence, we know that no single organization can tackle this issue. We're looking at 1 in 3 women and girls being exposed to some form of physical or sexual violence in her lifetime. And less than 10% of survivors ever seek any care or support. So we need to work on both awareness of what women and girls' rights are within the household, community, at school, wherever girls are living, working, and playing, while at the same time providing an increased supply of quality services and case management through frontline workers and other systems. The funding, I just heard new data last week released by the Equality Institute. Globally, out of humanitarian ODA, only 1% of funding is dedicated to violence against women and girls work for such an enormous issue affecting such a substantial part of our population worldwide, never mind just in crises. We're very fortunate that the EU has come to the table with new funding, joint funding together with UNFPA and UN Women as part of a broader UN reform initiative and something called the Spotlight Initiative. And maybe Sandy would like to come in at some point in the discussion to talk about that. But we're really looking forward to joining hands with our UN sister agencies to accelerate our action on the ground at both the policy level, services, and social norms change.
Thank you, Lauren. I mean, this is one area where we're working very closely with our gender colleagues. As I said in the morning, we say to each other we are co-leading the work that we do. In gender-based violence, we have actually a great strength in the emergency. We're very operational, and we're working closely with UNHCR and UNFPA as the lead, UNHCR, and also sometimes other agencies. What we have done actually together is that we do have a minimum package now and standard, so virtually we know what needs to be done, right? It's the resources. As Lauren has said, our executive director was in Oslo, and one of the things they were asking for is that in all humanitarian response, there should be an amount that is earmarked for gender-based violence. Actually, I mean, our WASH colleague have been resourcing the risk mitigation, right, aspect of gender-based violence in WASH. They're one of the strongest, actually, sector doing that. We also actually have the call to action on gender-based violence in emergency and the real-time accountability, which a lot of donors, actually, our member states have made commitment to, and we do have a roadmap around it. We have the database, and this database is an interagency database. It's digital, and it manages the information system. And it's interagency, and so the operationalization of it in the field. Once there's a conflict, actually, colleagues deploy, and it's standardized, and all the protocols around it and all the guidelines are all standardized. So I think actually we're making a lot of headway around it, actually, in terms of gender-based violence on PSCA. I think there is now a real commitment within the humanitarian sector. The ISC has made a commitment to it, the principals have made a commitment to it, and different agencies are resourcing the architecture to prevent and respond to PSCA. But there's still a long way to go in building up the structures.
Thanks, Charlotte.
Yes, coming back to data information and data collection, because in the report it states that about 50% of country offices were unable to report on disaggregated data, and that is of course a concern. What do you do about it, and how are you planning to strengthen the results reporting in that regard? And it's also a question on age disaggregation of data, of course. So I'm curious to hear what you are doing to strengthen it. Thanks.
Thank you. And we didn't get to the issue on HIV either, so sorry about that. So back to HIV, we have to work on 2 fronts, both on the supply side, making sure that ART treatment is accessible and available in all the countries where we're working, so that pregnant mothers children and young people can access the services that they need. But then we also have to work at those drivers of why mostly girls, as well as other vulnerable populations, feel unable to say no or to really understand their rights in relationships. And that's partly because of gender inequitable harms in societies, as well as a lack of access to information. What are their rights? What will protect them and keep them safe? And where can they get help when and where they need it? And that means strengthening case management systems in the protection and healthcare sectors, as well as improving curriculums and access to online information. For disaggregated data, you're absolutely right, 50% is a powerful number, and that's where we're talking about program outputs. So that's the work that we do and need to be accountable for, something that we could actually fix. I guess a positive ray of light is that we have this number. We know the scale of the problem. And now we need to work on the capacity building initiatives, right down the reporting chain. We're very pleased to have launched this year in July what we call Gender Pro, which is a course with George Washington Women's Institute to really train more and more professionals in UNICEF about the importance of gender work, as well as quality reporting. We're also rolling out program guidelines to all our country offices, as well as setting up stronger accountability measures, making sure that no UNICEF report gets issued without that disaggregated data. So with growing awareness and growing leadership and attention, we hope that we can report better results next year around. Thank you for reading that statistic, and that's really great. Thank you. I should just say, maybe as a last comment from my end, if the chair allows me, that this is exactly the kind of conversation that we really appreciate with our partners. I like to refer to it almost as a sort of council of advisors and leadership. We're all grappling with similar issues: inequitable workplaces, a need to really beef up our gender expertise and capacity internally as our commitments to gender equality get bolder globally. And so if we can keep sharing policies, what is it that we're all doing to prevent harassment, prevention of sexual exploitation and abuse? What lessons are we learning about disaggregated data reporting and analysis, as well as making our workplaces more gender responsive? So thank you to all of you, and I encourage you to join me in more conversations on this issue.
Thanks, Lauren, and thanks to the panel. If I can also add to Charlotte's question on a couple of points. I mean, UNICEF is kind of reorganizing its whole planning, monitoring, and reporting function. I think recognizing that there's more work to be done. And we still have, in producing these reports, systems that in some ways are not routinized. They still rely on questions that get asked once a year, that draw that data doesn't come systemically to the fore. And I'm pretty excited by the fact that we're committing or recommitting, if you will, to this area of work, which then should address issues like gender disaggregated data, like more real-time information on how a country is doing and how UNICEF is contributing to how a country is doing. One of my pet peeves is when we say country X has gone from Y to Z, therefore UNICEF is doing well. No, it's a question of both what the country is doing, but also how UNICEF is contributing. And I do feel that when we put our minds to it, and again, credit is due to the gender colleagues here, but they put a lot of effort into figuring out what exactly is a percentage of funding which can be attributed or contribute to gender results. I think we've seen a significant kind of improvement in that reporting. So the next frontier is indeed to make sure that the gender disaggregated data is out there. Colleagues, Megan and I have been doing a tag team the whole day today and kind of yinging and yanging on the sharing. This will be my final installment as I turn over back to Carla and Manuel for the humanitarian segment. But let me conclude from my end in two ways. Firstly, by saying thank you to all of you who contribute to these results, not just the thematic funding, but just generally who contribute to these results in the different ways that you're our partners. And thank you specifically to those of you who are partners in thematic funding and any kind of high quality support that is on your mark, that allows us to be flexible in how we pursue these results. And then secondly, thank you for being an audience that has asked interesting questions that have made us think today. And as Lauren just said, I think the idea that we have these opportunities for dialogue is very much why we have these sessions, so that we can continue to interact, think through issues as we move forward. So for me, it's been a great day, and it's not over for you yet, I'm afraid. I'll put you in the hands of Carly again. Thank you, panel.